for tonight. How can we approach working alongside a behaviourist and a vet? So, Gwen, in your experience, have you had any experience working alongside behaviourists with your pain clinics?
Yeah, well, I think I started off actually as a GP vet back in the early noughties, working with behaviourists, because I realised as a vet, I just didn't have the depth of knowledge I needed to guide my clients through some of the issues that they were having with their pets. And actually, one of the receptionists I worked with in my first job is a well-respected behaviourist down in Southampton, and she was doing her PhD at the time, or about to, and she influenced me right at the start. And then I worked with behaviourists as a general practitioner and realised how important it was to keep that two-way communication open about your patients. So I really quickly learned that I needed to practice within my competence, and I wasn't competent actually to deal with some of the behaviour issues that we see. And at that point, I don't think I really had an understanding of how pain affects behaviour and how often pain goes undiagnosed with behaviour problems. So once I started working more in chronic pain, that became more and more obvious to me, and I started to get referrals from vets that had been bullied into referring animals by the behaviourist. But really frequently, that behaviourist had been approached independently by the client, the dog or the cat owner, rather than by the vet. So,
yes.
And what I'm seeing now increasingly is that vets are actually keener to work with behaviourists, but there's still a reticence quite often to refer animals to a behaviourist. And I'm not really sure why that is, because I thought most vets were really happy to hand an animal over that had a problem that they couldn't really deal with from a behaviour perspective. But anyway, seeing these clients which had approached their behaviourist independently, and then obviously the behaviourist has to go back to the vet to say, I've been asked for this. I've been asked to look at this animal. I need a referral from you. And so then that relationship's been established between the vet and the behaviourist. And then if they come to me, I'm really keen to reinforce that relationship between the vet and the behaviourist and the client, because otherwise what I see quite a lot of is the clients working with the behaviourist quite successfully, but they're having to go back to report to the vet what they're finding, and there's not that sort of three-way communication quite as there should be.
Yeah, I think that's definitely been my experience from a general practitioner point of view, is that I definitely haven't had, I've had one successful case where I had a really good relationship with a local behaviourist, and since then I think I moved, and so I haven't really found anyone in this area to work with, and so it has been a lot of the owner-led, and interestingly.
And I think now in the last couple of years, good behaviourists have become so busy, it's actually really quite hard. So we need to know how to find a good behaviourist and then somehow get into their books. And I'm really hoping that the number of certified behaviourists builds, because there's a real shortage